Chédiak Higashi syndrome, USMLE style question for you. A 6-year-old boy is brought to the clinic by his parents due to recurrent infections and abnormal pigmentation of his skin and hair. The patient has a history of frequent respiratory infections and has had difficulty with prolonged bleeding after minor injuries. Physical examination reveals partial albinism with light-colored skin and silver-gray hair. Peripheral blood smear shows large, abnormal granules in neutrophils. Which of the following is the underlying genetic defect in this patient's condition? A. Mutation in the gene encoding the enzyme hexosaminidase A. B. Defect in the lysosomal trafficking regulator gene, LYST. C. Mutation in the gene encoding the dystrophin protein. D. Defect in the fibrillin-1 gene. E. Mutations in the CFTR gene. Answer and explanation. The correct answer is B. Defect in the lysosomal trafficking regulator gene, LYST. Chédiak Higashi syndrome is a rare autosomal recessive disorder caused by a mutation in the LYST gene, which encodes the lysosomal trafficking regulator protein. This defect leads to the formation of abnormally large lysosomal granules in various cell types, including neutrophils, melanocytes, and platelets. Clinical features include recurrent infections due to impaired phagocytosis, partial albinism due to defective melanosome formation, bleeding tendencies due to abnormal platelet function, and neurological abnormalities. The other options represent conditions unrelated to Chédiak Higashi syndrome. Hexosaminidase A deficiency is seen in Tay-Sachs disease. Dystrophin mutations are associated with Duchenne muscular dystrophy. Fibrillin-1 mutations are associated with Marfan syndrome. CFTR mutations cause cystic fibrosis. Key takeaway: Chédiak Higashi syndrome is caused by a defect in the LYST gene leading to abnormal lysosomal function, recurrent infections, partial albinism, and bleeding tendencies. Let me